All right, good morning, everyone. My name is Gina Ford. I'm the Communications Director for Prince George's County Executive Angela Alsobrooks. This morning, the County Executive and Dr. Carter will be bringing an update in terms of where we are with coronavirus. And after that, we'll be giving some very critical information with the 2020 general election and some changes that are upcoming. So first, we'll have County Executive.
Thank you. Good morning, everyone. And thank you for joining us today as we bring some critical updates to our community regarding COVID-19 and a few other announcements as well. I want to thank, first of all, Dr. Carter, who is our Chief Medical Officer, for being here this morning, Ronnie Gill, Director of Emergency Management. They have done an outstanding job, complete with their teams at the Health Department, and our emergency management team. And so I want to thank them and all of our government employees who have truly done a yeoman's job in helping us to navigate this pandemic. Today, I would like to provide you with our latest updates on COVID-19 and government operations. I also want to go over some updates that we have regarding our upcoming election, as well as Census 2020, two very important items for us. As you know, our county has been hardest hit in the region with respect to COVID-19. We have, since March, had over 29,000 of our residents who have become positive with COVID-19. We have also had at least 4,000 of our residents who have been hospitalized, and unfortunately, 813 of our loved ones have lost their lives to this virus. So needless to say, we've said it over and over again that this has been so personal for all of us. These are our loved ones, family members, our friends, colleagues, neighbors. And so this has really been a really trying time for all of us. And we continue to keep in our prayers not only those who have been sickened by this virus, but we know so many, even as we continue to move forward in this, are still grieving the loss of loved ones. And so we continue to keep all of those people in our prayers as well. And so we know well the pain of COVID-19, but I want to tell you also that I could not be more proud of Prince Georgians who have rallied in amazing ways during COVID-19, who have risen to the occasion. I have to tell you, they have looked out for their neighbors, and I'm just so proud, not only of all of our residents, but proud of the businesses who continue to do an absolutely beautiful job in following our guidance regarding COVID-19 safety precautions to keep everyone safe. I'm proud that we have looked out for each other. You have been wearing your masks. You have been social distancing. You have sacrificed many of the gatherings that we would ordinarily have. And because of our collective efforts, I am so happy to say that we continue to make tremendous progress as a community. Dr. Carter will give you additional updates, but I can tell you that after the Labor Day holiday, and I had to come out and make sure that we cautioned everyone to be very careful about the larger family gatherings. We did see a brief spike in our positivity rate, which went up to 5.4% following the holiday. But we have received the news that as of last week, our positivity rate has dropped back down to 4.1%. Under that key 5% threshold recommended by many health experts. There are still some metrics that we are looking at that remain higher than we desire. Our infection rate this week is, for example, sitting at 1.05. This is higher than the state rate, which is at 0.99. That places us in what health officials call a medium risk, and to be low risk, we would need to be under 0.9. Also, our average daily case rate per 100,000 residents is 11.7, which is actually just over the threshold in the high risk category. To get this down to a low risk category, the average daily rate would have to be 5 per 100,000 residents. And so I know these are a lot of numbers. Again, Dr. Carter will come to you and explain them greater. But these are key metrics that we believe must come down before we are comfortable moving to the next phase. And so we are remaining in phase 2 as of this time. I do still want to commend Prince Georgians because this could have been so much worse. As bad as it was, the truth of the matter is, had we not acted quickly, and remember that Prince George's County was the first jurisdiction in the state to mandate that masks had to be worn in all of our, in the stores and on our transportation. And had we not acted quickly, this really would have been a lot worse. And so we'll continue to monitor all the numbers and look forward to making announcements in the very near future as our data allows regarding a roadmap forward and how we might begin to safely move into some of those other phases. When this pandemic hit, we had to quickly shift our government operations. You're aware that much of our workforce moved to teleworking, and we transformed our government services to serve residents virtually. Again, I want to say I'm so proud of the dedicated public servants in our government who have continued to serve the community during this pandemic. That's an important point because most people say, well, when are we reopening government? Government is never closed. And so I want to thank most especially all of our frontline workers who continue to work daily at great risk, and all of our county employees who have continued to work. Now, we know that some of our operations, however, are better served in person, and we have been actively working on plans to ensure that we can reopen certain buildings and facilities safely for both county employees and the residents that we serve. And so I am happy today to finally announce that we are ready to reopen our Animal Services Facility and Adoption Center this coming Monday, September 28th. This facility will reopen by appointment only for residents, for services to include pet adoptions, pet redemptions, and animal intake. And so the facility will be open for appointments Monday, Tuesday, and Friday from noon to 6 p.m., Wednesday from 11:30 to 7:30, and Saturday from 10 a.m. to 4 p.m. The facility will be closed on Thursday and also on Sunday. This decision was not made lightly, and we have a full plan in place approved by our health officials, and you know that Dr. Carter does not play. We will ensure that all of our staff can remain safe, that our customers will remain safe who enter that facility. And anyone who has an appointment should be reminded that you must wear the facial covering in order to come into the facility, and you'll receive also a temperature check before for being allowed to enter that facility. So that is important to note, as well as to bring your mask with you. That facility will follow current COVID-19 guidance and will limit the number of people allowed in the public access sections to maintain social distancing guidelines. All appropriate personnel, personal protective equipment, and protocols, including building cleaning, physical barriers, directional signage. We'll have the hand sanitizer, hand washing areas. All of that will be available to the public in public areas. Staff and volunteers who enter the facility will be required to have up-to-date negative COVID-19 testing in order to come into that facility and to serve the public. For more information about the reopening of our Animal Services Facility, please visit environment.mypgc.us. Again, environment.mypgc.us. And I want to sincerely thank the staff at the Animal Services Facility. They have done a tremendous job of caring for the animals in the shelter during this pandemic, loving them and being there for them, as well as our animal control officers who have continued serving the community and responding to calls. And I also want to thank all of our community partners who have worked with us to help place animals in their forever homes while the facility has been closed to the public. Our staff does look forward to serving the community. We have heard from so many that you are anxious to get back to that facility and that you'd like to go in and have the opportunity to adopt your new family members. And so we're really pleased that we'll be able to welcome those pets into their homes. Now, I want to provide a number of updates on the 2020 general election, which, as you know, will look very different than elections in the past. And this is an issue that, of course, is very near and dear to all of us, as we have seen in terms of the voting process. Much like everything else in our lives, COVID-19 has really significantly changed the way that we do things. And so as a reminder, voting by mail is the safest way to vote. There's no other way to say it. It is the safest way to vote. And we know that during the June 2nd primary election, 96% of our residents opted to vote by mail in the election season. And so we know that this is a safe way to vote, but the thing that you must know, and it is so important that we help to spread the word regarding this, is unlike the primary election, what has been mailed to your home, and most of you, if not all of you, should have received, those who are registered should have received by now an application to apply for a ballot. That has been received by you. It was in your mail. But what you should know is, unlike the June 2nd primary, it is not the actual ballot. I need people to know that. First of all, that the mail you received is not junk mail, and also know that your ballot is not in that envelope. That is an application to apply for the mail-in ballot. That is really important, because I don't want anyone to be confused by it or to wait beyond the deadline. The deadline to receive the request for the mail-in ballot by the Board of Elections is October 20th. Again, it is October 20th is when the Board of Elections must receive that application for the ballot. And so we are encouraging voters in our county to request their mail-in ballot as soon as possible. Do not wait. Do not wait until even October 19th or 18th if you can help it. Please get those in immediately. Again, you should already have those in your mail, and just fill them out. They're very easy to fill out. And if you need any help with that, you can also just reach out to us, but we want everyone to please begin to send those. And we are saying to everyone, don't wait to vote safe. And so if you wait until the October 20th deadline to submit your request, we're concerned that your ballot may not arrive until much closer to Election Day. So if you plan to vote, please send in the request as soon as possible. Also, you should know that if you have already submitted your application to request your mail-in ballot, that you should know as well that the application, one other point I want to make is that you should fill it out completely and legibly, and to sign it and return it in that envelope. And the reason that is really important is because I'm understanding that we had to disqualify about 6,500 of the ballots that we received during the primary election because there were errors on it. We don't want any errors. Take your time, make sure that it is legible, make sure that you sign it, and that you return it in that envelope. And so far, you all have been diligent. We've received a little over 210,000 ballot applications, and so you're already requesting those ballots, but we certainly want more people to apply for the mail-in ballot to reduce the lines during early voting and on Election Day. And if you don't want to fill out the paper application, you can also request the ballot online. It's as simple as going online to elections.maryland.gov. Again, that's elections.maryland.gov, or texting VBM for vote by mail, VBM to 77788, VBM to 77788. And finally, if you prefer to complete the application in person, you can complete and submit your request for a mail-in ballot at our Board of Elections, the County Board of Elections, which is located in Largo. So you can go there in person if you prefer to do it that way. Now, the state, we're excited to say, has started to mail out the first batch of ballots. Those ballots should have hit the mailboxes starting today, September 24th. It'll go between September 24th and 28th, so start looking out this weekend. You should start receiving your actual ballot in the mail beginning today and throughout the weekend if you have already requested it. And so start looking for that. And we will have 42 drop boxes throughout the county, and those will be set up in 2 phases. So important to note, just to make sure I didn't say it too quickly, for those who have already applied for the ballot, and if you didn't apply, you know you still have that to do. But if you applied, your ballot should start arriving in the mail, and we will have 42 drop boxes around the county. Beginning at the end of next week, we'll have the first wave of those drop boxes that should be available. It should be 22 drop boxes that will be available around the county. 11 of them will be at the early voting sites, designated as early voting sites, and then we will have an additional 11 that will be added, and those locations can be found on our Board of Elections website, which is elections.mypgc.us. Again, elections.mypgc.us if you want to know the location of those drop boxes. And again, that's for individuals who want to vote in advance of Election Day. You can drop them off there. The additional 20 drop boxes will be delivered and installed around October 15th. So by October 15th, all 42 of our drop boxes will be operational around the county. I want you to know, for anyone who's concerned about it, we will have 24-hour security around each of those drop box locations because we want to make sure of the integrity of your ballot. So not to worry about that. 24-hour security around each of the drop boxes from now through Election Day. We're also strongly encouraging our voters to make sure that if you do not prefer to vote in advance and you want to vote actually in person, that you should know that we will have 11 early voting sites and 41 Election Day voting centers. And so that's if you choose to vote in person. They will be open from 7 a.m. until 8 p.m. And you should know that early voting will be from October 26th through November 2nd. So if you want to vote in person and vote early, which we do encourage, please go October 26th through November 2nd. Again, to the 11 early voting sites, and on November 3rd, we'll have the 41 Election Day voting centers, including the one at FedEx Field, which will be available for you to vote. Finally, I want to speak about the 2020 census. You all have heard us talk about this. We have talked about it because it is critically important. The United States Constitution, Article 1, requires the United States to count its residents every 10 years, and that's what we are doing. We're in the census count. It is by the U.S. Constitution. And this year, the deadline to respond to the census is next week, September 30th, and that is just 6 days away. The dollars that come as a result of that census count are critical federal dollars. You should know that as a result of the last count, we had about 20,000 of our residents who went uncounted, and it cost the county $363 million in federal funding that was due to come to us. Those dollars are critical dollars that go towards seniors, Medicare. It also goes toward providing lunches for our children and many other critical needs we have. You should also know that the census determines businesses that come here. It also determines who we get as representatives, the number of representatives we get in Congress. And so that is a very important, the census count is very important for us to reply to. Now, what I can tell you is that as of this past week, I tell you I am so proud, once again, of Prince Georgians. You have now met where we were this time last year, but we still have those 6 days left, and we have about 11,000, I'm told, residents who have not been counted. And so what I need you to do, please, is to do what my good friend, State Senator Joanne C. Benson talks about when she says we want you to call, text, write, Lottie Dottie, and everybody, and let them know that we need them, please, to respond to the census count. We're not kidding about this. As a result of COVID, we're going to have some additional revenue losses. We're going to need those dollars to help us recover and to make sure we take care of everyone. And so you can do this easily online at my2020census.gov, or you can call 844-330-2020. And again, don't assume that the people you know have already responded to the census. Please do us a favor and just simply check in with your neighbors, friends, and others, and just ask the simple question: have you responded to the census? Please take a moment to do this. We really do count on those dollars. We need those dollars to take care of our community, and so we thank you in advance for that. So overall, I'm going to pass it over in a moment to Dr. Carter, but overall, we continue to make progress on COVID-19. We will remain vigilant and careful because in our estimation, we don't have expendable lives here. Every life here is so valuable to us, and so the decisions we make are decisions designed to make sure that we protect your life and your livelihood, and so we just thank everyone so much for your sacrifices and your diligence. We are, I believe we've just done so well where this is concerned, but we still are not out of the woods, and so we want to just continue to be careful, to keep yourself and your family members safe by wearing those facial coverings, making sure we do the 6 feet of distance, that we're refraining from those large gatherings, because the virus is still with us. But again, thank you all so much. We will continue to work together, and you know, my prayers continue to be with those who have suffered in so many ways and who are grieving. And I'll pass it over at this point to Dr. Carter. Thank you.
Thank you, Madam County Exec. And good afternoon, everybody. Every life is valuable, and that's our driving force in the county and the health department. And just so you know, the COVID is still slowly spreading in Prince George's County and in this region. We can't get weary at this point. We cannot let our guard down. We have to stay safe. We got to stay smart, especially when we leave our home. Even if the state and other counties have decided to head to phase 3 for reopening, Prince George's County will remain in phase 2 for now. This is a long haul. We need to be a bit more cautious in our reopening. I'm going to talk a little bit about the data. There's still too many COVID tests coming back positive in the county to feel comfortable to move to phase 3. Our test positivity rate has declined back down to around 4%, which is good news. However, we have not consistently stayed below 5% in our positivity. Now, to be clear about the positivity rate, it tells us two things. One, it tells us whether or not we're testing adequately, but two, it also tells us about how transmission is occurring. Now, currently, we're testing adequately. But when it doesn't go down, that means there is some new cases showing up and there's transmission. So you can't just look at the positivity rate when you're considering moving to a new reopening phase. For example, we also look at the infection rate, which has been really stubborn in terms of moving. The infection rate measures, on average, how many people one person will spread to the next person if they have COVID. The county's rate is still just above 1 other person being infected, transmitting it. Now, back in June, we got down to 0.7, which is a really good place to be in terms of that. But we've gone back up. And we're, like I said, above 1. Where we want to be, we want to get it below 0.9. The other metric that we look at is on our average number of new COVID cases per day, which is still too high, per 100,000. So right now, our new cases per 100,000 is around 11 new cases per 100,000 per day. That translates into more than 100 folks per 100,000, more than 100 person per day getting infected with COVID. This is still in the high-risk category for COVID transmission, along with our positivity rate. A daily case rate below 10 will move us to a medium risk. And to get to low risk, we need to be below 5. And 5, that means when you're at 5, you're getting essentially 45 new cases a day. We're not close to that. We're over 100. So that's why we're being cautious. It's really clear. It crept down a little bit. Our new cases per week crept down a little bit. In the summer, it ticked back up, and it keeps bouncing around. Several weeks ago, it was around 1,000 cases a week, so you know we're doing better. For most of August and into early September, our new cases per week had totaled between 700 and 800. While we're still waiting for the last of our numbers to come in, it does not appear that we had a significant spike after Labor Day, which is really, really good, and that's reflection on our people. That's encouraging. And the county executive and I are hopeful that we can start relaxing restrictions if that trend keeps going down. The other thing I wanted to talk about, one metric, is about the bed space in our hospitals, and I want everybody to be pretty relaxed about that because we have 60% of our ICU and our acute beds are available, so we have enough space in our hospitals. And so far, our hospitals have had fewer than 50 inpatients on its daily average with COVID. So we're doing really well there. And we're keeping our eye, of course, on that with weekly meetings. The number of our community members who have died from COVID is about 5 from last week. And even though that's low, that's just way too many. I mean, so we have to keep doing what we're doing, and I know I'm repeating myself. But it's still sobering to know that in this day, this affects us both physically and mentally, that we still have folks dying. And so that's why we have to stay really vigilant, especially when we know that we can tick back up at any time, and it can get worse. COVID will be with us for a while longer, and we must incorporate all these safety considerations into our normal life. This includes protecting yourself and your family, especially during this upcoming flu season. I'm encouraging everybody to get a flu shot. First, so that we can reduce the chances of getting flu, but also getting flu with COVID, because flu with COVID is not a good situation. So get your flu shot, and that can happen. It's possible. We must all continue to wear the mask in public. And it's especially putting it over your nose and your chin. It's not just to have a mask on. You have to have it over your nose and your chin. That protects other people, it protects you. It's a huge weapon against our fight for COVID. Please keep your 6-foot distance between yourself and others who are not in your household. But you have to understand that is the way to protect yourself. The mask and the 6-foot distance, that helps. That's going to help you. A lot of people ask me, what can I do to prevent COVID? Wear a mask, stay 6 feet away from somebody. That'll prevent it. Avoid crowds. There's a lot of large parties. A lot of people having large parties. You gotta eliminate those. Continue to wash your hands and clean your surfaces, especially in your home and in your office. The areas of the country and the world that have been most successful in combating COVID have been the ones who've been most successful at doing these things. So that's what we have to do. So I'd like to thank you all, and I want you to be smart and to make smart choices. Thank you.
All right, do we have any questions? Well,
I don't know if you got to hear what Governor Hogan had talked about earlier today about the vaccine possibly going to nursing home patients. Just any thoughts about that early discussion about vaccines right now?
Well, first of all, we know that at some point there's going to be a vaccination that we're going to have to distribute amongst our people to be sure that we get COVID under control. What we're doing in the health department and in the county, we're keeping our eye on the credible evidence that the vaccine is safe. It's two different things between developing a vaccine and distributing it. It's a big gap between that, because once you develop it, you got to make sure it's safe. Not until we're convinced that it's safe will the citizens of Prince George's County be subjected to it. So right now, because it's still in development, it's too early to talk about whether or not there is a safe vaccine or not.
In Virginia, some surrounding jurisdictions, we've seen some movement on schools reopening, smaller groups coming back. Obviously, Prince George's County is not Fairfax or Arlington, but has the dynamic changed that the county making tremendous progress? How does that impact the decision on schools possibly bringing some kids back?
So we're very comfortable with the decision that we've made to distance learn and to continue the practice of distance learning until the end of January, when we will reassess and make a decision about returning to some sort of hybrid. There will be information sent out to families at the end of December, and that information will also gather information from families about whether they feel comfortable, prefer a hybrid versus the distance learning. But at this point, given all of the information we have, we believe that the safest route for us is to continue the distance learning. Dr. Carter spoke about the positivity rate that has not remained steadily under 5%. This is the measure that we use to determine what our risk level is. And at this point, because we have just very recently gone over 5%, and we don't know yet what the fall will bring. Dr. Carter has mentioned the flu season that is coming. We think there is great risk involved in moving out of the posture we're in right now. And so we're going to continue to make sure that we keep the health and safety of our students, their teachers, administrators, and family members in mind. And we think the distance learning is the best way for us to do that now. We are not ready to go to the hybrid.
Regarding the election, could you expand upon the message? You kind of touched on it in regards to a handful of those residents who still are leery about wanting to mail their ballots. They like the old-fashioned way of going in, counting their ballots, making sure they can see that it was counted. What's the message?
So there are, yeah, that's a great question. So there are a good number of our residents who still prefer to go in person, and we have made it so that that can happen and so that it can be done safely. We want to assure the public, for those who prefer to go in person, either through early voting that begins on October 26th, that we will have those 11 early voting sites around the county where they will be able to go and vote. And we will have 41 voting centers on Election Day for those who prefer. Now, what we can say to people is that we do still believe that it is safest to be able to vote early and to utilize the 42 drop box locations that we have around the county for those who just don't want to use the United States Postal Service. That is still an option, that you can go to one of the 42 secure drop box locations, which I've told you will be secured 24 hours a day. We will have security at each of those boxes. For those who just want to drop it off themselves, don't want to use the U.S. Postal Service, that's still an option. But we believe, and I am urging everyone to vote safely, and we believe the safest way to do that is either to vote by mail or to vote through those drop box locations and to vote early. If you can at all prevent it, please don't wait. We really believe that it is safest to avoid the long lines that will form on Election Day. We are still in the middle of a pandemic, and we believe that the safest way for our residents to vote is to do so early by utilizing either the mail or those drop box locations.
How many will be available? Is it next week or in a couple weeks?
So at the end of next week, we have the first 11 of our drop box locations that will be available. We have 22 altogether, but the first 11 will be available. I'm sorry, the first, yes, 12. The first 22. Thank you so much. Our communications director to the rescue. The first 22 will be available, and then we'll follow up with the additional 20.
Given what the metrics are saying right now, do you have any sort of ballpark timeline on when a maybe limited entry into phase 3 could occur, just like we saw with phase 1 and phase 2?
So, we'll look at it again in the next, we've been usually doing this in 2-week phases as we get back information, and so we'll continue to review the information we have now. I believe in the next 2 to 3 weeks, we'll be able to review the data again, and we'll accept the advice of our health officials. Dr. Carter, I don't know whether you have anything additional you'd like to say about that?
No, that's correct.
Okay, so Dr. Carter agrees that in 2 to 3 weeks, we can look to our health officials who will give us an indication whether they believe it's safe for us to move into phase 3. Now, what I can tell you is that we know there are some additional openings that must happen, but for the most part, the county is open. We are open.
Is that all? Thank you, everyone.
Thank you so much, everyone.